Hope you're all doing fine. Let's discuss some of the Prometric exam questions for nurses. A nurse is assessing a 6-month-old infant that has reduced responsiveness and interaction with the environment to smile or make eye contact. The nurse notices that the infant is not gaining weight as expected. What diagnosis should the nurse anticipate? Celiac disease, failure to thrive, cystic fibrosis, growth hormone deficiency. So the correct answer is failure to thrive. The nurse is assessing a 2-year-old child with Wilms surgery. Which of the following should the nurse avoid? Putting the child in lateral position, palpating the child's abdomen, putting the child in private room, provide mouth hygiene 30 minutes after meal. So, which one she should avoid? Palpating the patient's abdomen, baby's abdomen. A 10 baby boy has diagnosed with Down syndrome. Physical examination revealed flattened nose, low set ears, upward slanting eyes, single palmar crease. Which of the following is the most common congenital anomaly associated with this disease? Developmental dysplasia of hip, congenital heart disease, hypospadiasis, and pyloric stenosis. So the correct answer is congenital heart disease. The family is caring for their youngest child, Justin, who is suffering from tetralogy of Fallot. Which of the following position is used for congenital heart condition? Semifallopian position, knee chest position, and prone position. So the diagnosis is tetralogy of Fallot. So which is the position that is best? That is knee chest position. A 4-year-old child is seen in the emergency department with spiral fracture of the left arm. The X-ray examination showed previously broken healed bones. What is your immediate action? Call social services to immediately arrange foster care for the child. Ask the child about the previous accident and management. Report child abuse to the local authorities. So the correct answer is report the child abuse. Why? Because patient has a spiral fracture now and previously he has broken healed fracture. So this is the indication of child abuse. The nurse determines that the client understands the purpose of vitamin K injection for her newborn. If the client states that vitamin K is administered for which purpose? Newborn lack vitamin, newborn have low blood levels, newborn lack intestinal bacteria, newborn cannot produce vitamin K in the liver. So if the mother says newborn lack intestinal bacteria, that means that she understood the purpose of vitamin K injection for her newborn. Clear? When performing a newborn assessment, the nurse should measure the vital signs in the following sequence: pulse, respiration, temperature, temperature, pulse, respiration, respiration, temperature, pulse, respiration, pulse, temperature. So when performing a newborn assessment, this is the sequence: respiration, pulse, and temperature. The newborn stomach capacity is 6 ml. Thank you for watching and see you in the next session.